There's a saying that you can judge a society or a culture by how it takes care of the folks that are the most vulnerable in it. So whether that's little babies or whether it's folks that are elderly that may not be able to care for themselves anymore. And so the work you're doing really is a ministry and a calling, and I'm so thankful to be able to be a little part of that. But this is a way to sort of both celebrate you and your achievements up to this point with this graduation, but also to sort of give you a sense of calling and responsibility of what you have to live up to. We have taken to bringing in folks that are CNAs that are going to give you the straight scoop, somebody that is doing right now what you will be doing, and I'm really honored to introduce Miss Lisa Harless. Lisa is a CNA 1 at Grace Heights. I've had a chance when I've done my rounding up there to be able to see her in action, and she's great. And she's very thoughtful and possesses a lot of wisdom for a lady that's pretty young. And she's going to come and share some of that wisdom with us today. So Lisa, please come up.
Public speaking is not really my forte. So just because you cannot see it doesn't mean it's not there. Here's a story from a night I worked third shift. One night a resident called me into her room to tell me a pony was trying to eat her shoe. I could have told her there was nothing in the room, but that would have been making of an argument. So I told the pony to shoo. I asked her if she needed anything else. She said no, and I left. Not 5 minutes later, she called me for the same thing. My response was the same as the first. I asked if she needed anything and left again. She rang again. Before I went into her room, I went to my lunch bag. Then I answered her light. The pony was back. She was worried it was never going to leave, and I was starting to worry as well. I told her I had a plan. I took the apple from my pocket and called the pony. I led the pony out with the apple and explained that I was going to crack her door so it didn't come back in. It worked. She didn't have a problem for the rest of the night. First and foremost, congratulations. I can honestly say that working in nursing is my passion. The good days along with the bad, the hard as well as the easy. I've learned a lot along the way, and here are some tips I'd like to share with you. Safety is always number one. Every resident is your resident. Every alarm going off is your alarm, because safety is number one, and every resident is your resident. Although you are coming to work, you are working in someone's home. A smile can always make the world a brighter place, not only for our residents, but also for anyone coming into contact with you. Work smarter, not harder. Always work as a team. If you do not ask, you do not know. Working in the nursing field will not always be textbook perfect, and that's okay. You can fix a mistake, but you cannot fix a lie. Never say that things are quiet, because as soon as you do, all things go awry. Always find time for what I call the 4 C's. Clean nails, clean teeth, clean clothes, and comfortable. If a resident is scrunched down at the foot of the bed, not only is it not safe, but it is uncomfortable. Be more than a CNA. Listen to your residents and create a better relationship in order to help learn daily habits. I hope that in the days to come, you put some of my tips to work. I wish you the very best on your continued journey.
Good evening. My name is Amy Garrison. I work at College Pines as the Assistant Director of Nursing, Interim Director of Nursing right now. And I have 3 of the graduates that will be joining our healthcare family down at College Pines. And tell you a little bit about each one. Jayme Franklin Baker. Jayme not only just finished her CNA program, but she's newly married in June, so congratulations on both things. She has a supportive husband at home, Katie Baker, that's seeing her through her healthcare journey right now. She becomes to join the team. She says she chose to be a CNA because she has a passion to help people. Her passion to join us was ignited by the residents who thanked her for the care that she gave, and she received that thanks on a regular basis. Jayme shared an experience she had while providing care during her training. She said that a resident had passed away, and Jayme, knowing that she had made them comfortable, impacted her greatly. Just by the care she gave, She knew that she wanted to do the best of her ability in any situation. I present to you Jayme Franklin Baker. Congratulations, Jayme. Sara Peterson is also joining the College Pines family as a healthcare worker. Sara is just starting her career path. She does have family and friends who are supporting her along the way. Sara says she chose to be a CNA because she enjoys helping people and giving them a reason to smile every day. Her passion is ignited by knowing that some places in the world, people are not given the care they deserve. Sara says this makes her very determined to provide the care that every resident should be provided, regardless of their situation or background. Sara also shared an experience she had during her clinicals. Sara noted that a resident became very combative due to the death of another resident in the facility. So at that time, Sara realized how much the residents are actually affected by one another. She said that was a very large impact on her in the fact that she knew how she treated each resident had an effect on the other residents. So Sara plans to give the best care she can give to everyone as it impacts each of them. Sara Peterson. Mary Tabithy Wyann, she goes by Tabitha. She does have her fiance Jacob Bryce and her son Braxton that are very supportive and helping her on her journey. Tabitha says that she chose to be a CNA because she wanted to make a positive impact on people's lives. Her passion is ignited by the residents that tell her how she's helped them and how she's made their day better. Tabitha shared a story from her clinical that she was able to care for someone who didn't have a family. It touched Tabitha greatly just knowing that she assured the person that they were not alone and that she was there. So I want to present to you Tabitha Wynn. Congratulations.
My name's Linda Lackey. I'm the Director of Nursing at Grace Heights of the hospital here, and that's Debbie Morgan, our administrator. And I wanted to present the two CNAs that will be becoming part of the Grace Heights family. The first person is Renee Buie. She is married to Chris Buie, and she has two children, Caitlin and Dallas Hudgens. And she chose to become a CNA because she loves being able to help other people and being able to provide care to those that need it. What ignites her passion is just being there for others, being able to take care of other people and showing compassion towards them. I love being a part of making a difference in people's lives, even if it's just by helping them with their needs throughout the day, which is a big part of the CNA work, is being able to help them with their needs. During clinical, one resident asked me to please not leave the room, to please just sit and talk and be there. It broke my heart and made me realize that sometimes we in the healthcare team are all these people have, and that's very true. That made me realize that no matter what, I want to be here for the residents and to provide the very best care possible and to take the time to talk and listen to the residents, because sometimes that's all they have. And that's very true. And I want to present Renee Buie. Next, I have Charlene McCall. She is married to Harvey McCall, has a son, Hunter McCall, one Lance Garland, and a stepson and a stepdaughter, Brandon and Shannon McCall, and a granddaughter also, Lilia Katine. Is that good? I'm terrible with names. Anyway, she helped tend to a relative during a period of declining health, and both her and her grandfather encouraged her to go back to school and get her nursing degree, which she is working on at this time. She's in school. I'm enrolled at WPCC, and this is my first step in achieving my nursing goals. I truly enjoy elderly people and the feeling you get when being able to make a difference in their lives. I know healthcare is a very hard job, but it is also very rewarding. I'm very happy and excited about this career change. And she used to work at KFC, which is one of my favorite places to eat, and I think that she's doing the right thing. She had one resident ask her one day, just before she was going to go home, to please take her outside for just a few minutes. Instead of going home, I asked the nurse if it was okay, and of course the nurse said sure. So I took her, and for about 10-15 minutes she was ready, and they went out there for about 10 or 15 minutes, and then she was ready to come back in. She told me she had warmed up, which I understand that, and they were able to spend a little time together, and it really seemed to build a good relationship with her. Sometimes just a few minutes of our time makes a huge impact on someone else's life, and helps to build healthy relationships with their residents and forms trust between you and them. That's absolutely correct. I present to you Charlene McCall. Congratulations, everybody.
I'm Nancy Lovelace, and I'm the Director of Nursing for Grace Ridge Retirement Community. And I'm the empty seat. Unfortunately, Brandy Sommerville couldn't be here today, and she is the newest member of the Grace Ridge family. And we're blessed because we already had Brandy on a different level. Brandy was a security officer for our facility and decided that she wanted to get closer to the bedside and went back to become a CNA. And so now is going to continue her career at Grace Ridge as a CNA. So I'd like for us to congratulate Brandy in her absence. Thank you. And at this time, if the new CNAs will come up, and the person that's going to pin with them will come up, we'll go ahead and move on to the pinning portion of the ceremony. Was good? Okay, go ahead and pin, y'all. Thank you.
But the pin and the fact that we hope you will wear it should be a reminder that the gifts that you've been given and the folks that have helped you along this way, it's your chance now to help pass that on to the next generation. And that's why, and isn't Lisa great? It was so great that I love hearing her talk, but that's an example of how somebody that is not that many years ahead of you in this process is able to give back. If you would please bow your heads. Dear God, we are mindful that in your providence you have called these women together, that you have called them to a particular ministry, and that you, through their friends and their family and their instructors, have been equipped. We ask that as they are performing this ministry, that you would continue to give them strength when the task is hard, patience when the task is frustrating, and compassion when sometimes the very residents that they're taking care of are hard to be compassionate to. We ask that you would have them show love to other people as you have shown to us. And we ask that you would remind us daily that this is work that we do not just for a paycheck or for this community, but work that is done to your glory. And we are thankful for that. Amen.
Amen.